Good afternoon to everyone. Now it's time to present to all of you the results of the clinical audit on vaccination in pediatric transplantation. As most of you remember, this clinical audit, Dr. Daniele Donà from Padova, specialist in pediatric infectious diseases, kindly accepted to prepare, to design, and to present the survey in the last board in Padova in November 2018. And the survey was sent to all of you. Most of you have answered the survey, and we have now the results. And Dr. Daniele Donà, again, kindly has accepted to present to all of you the results. So, Daniele, when do you want?
So, thank you for this introduction and good evening to everyone. And as you know, vaccination pediatric transplantation was the clinical audit conducted last year, continuing the work line of those topics in pediatric transplantation on which there is no general consensus. So this project started after the webinar recommendation for immunization of solid organ transplant and hematopoietic stem cell candidates and recipients that was released in 2018. So this audit's object is to know what we are doing at present in different centers and programs. So we are including all those questions, investigating all aspects related to the topic of vaccination. In Padua. So, and it was discussed in situ with board attendance and subsequently submitted to all members. So after a careful evaluation, we send it to all, and so collecting all your responses. So before starting to review the responses, I would like to thank you for your commitment and your time, especially in this challenging period. So as I said, this survey was sent to all professionals from all transplant programs, both hematopoietic stem cell transplantation and solid organ transplantation. All were invited, and 19 from all ERN TransplantChild center response in 11 countries. So what I'm going to show you today are just preliminary data, so what we have received, and before starting with the further analysis. So starting with solid organ transplant, we have received 28 responders from 16 sites from 10 countries. And let's briefly review the responders' profile. So we can see that the most responders deal with liver and kidney transplant, with an experience greater than 15 years in almost 50% of cases, or between 10 and 15 years in the 25% of cases, the Apple graph on the right. And incredible experience will also rise by the number of patients followed by each center. So the 70% of centers follow more than 100 patients. And interestingly, immunization, while the 40 red area on the Apple chart in the bottom left have a protocol only for solid organ transplant, and the 25 for both hematopoietic stem cell transplant and solid organ transplantation. So a good news is that more than half, so the 53% of sites reported that between 80 to 100% of patients were fully immunized at the transplant time. In the 25% of responders, the rate decreased to 40 to 80%, and even less in the 70.8 cases, the rate was even lower, between 0 to 40%. So what we do now? So we try to investigate the detail of the primary reason for the under-vaccination of those children who were not vaccinated on time. So, and we found that the timing and the general patient condition hesitancy play 15.7% and moreover, with the survey, we highlighted that the 11% of cases, the hesitancy was raised by the primary care physician. So, still proceed with transplant, informing parents about the risk. So the 32.1% organized meetings with parents to provide correct information about vaccination and the risk of transplant without immunization. For the 21.4% on the gray area on the Apple chart on the right, 1.4% of responders do not proceed with transplantation without a proper vaccination, and the 7.1% usually delay the transplant. So, do you check antibody titers before the admission to the waiting list? The most checked vaccine antibody titers before admission to the waiting list resulted hepatitis B, followed by hepatitis A, and MMR. But interestingly,
sorry, is that the sound is not very good and it's cut? So maybe you can switch off the camera just to see if the connection is better and the sound here is also better.
Sorry,
Yes.
okay.
Sorry.
Just a second. I'm trying to.
In the bottom of the screen, you have a stop video, not the sharing, but only your camera, the one that is. Or maybe yes, in the top area of the screen, if you are sharing your screen.
Turn off camera. Can function so.
Sorry.
Okay.
This is a silent.
Okay.
No.
So is it work?
At the moment, we can listen to you. Yes, much better.
Okay. So please
Go on
interrupt. Please.
No.
Back to some slides.
We cannot hear you.
Okay. Can I start from here?
Yes, let's try.
Okay. So regarding the answer, the question, do you check antibody titer before the admission on the waiting list? We found that the most checked vaccine antibody titers before the admission to the waiting list resulted hepatitis B, hepatitis A, varicella, followed by MMR. But interestingly, it seemed that antibody titers are checked in most cases before the admission to the waiting list, rather than while the patients are on the waiting list. Since, as you can see from the slides, they are never or rarely rechecked in around 50% of cases. Can you hear me now? Okay.
That's good.
Thank you. So, question about the use of accelerated schedule for live viral vaccines. According to Transplant Urgency, we found that around 35% of responders do not use an accelerated schedule for live vaccine. And in detail, we see that the 40% is for varicella and the 33% is for MMR vaccine. But what we see from this question is that the 1/3, so the 30% of responders, currently recommends an accelerated schedule, while others reported its use in a variable rates. So, investigating if vaccination were provided by the transplant site, we found that more than half of centers provide some vaccination, while the 25%, so 1/4 of sites, provide all vaccination needed. So the remaining sites do not provide vaccination because of their organization and because these are provided by other services outside of the hospital. For those that provide vaccination, the one most dispensed were pneumococcal vaccine, hepatitis B vaccine, for influenza, and meningococcal vaccine. Before transplant, we see that the most recommended vaccination were, you see from this slide, actually all vaccination recommended before the transplant, and especially pneumococcal vaccine, hepatitis B, tetanus and diphtheria, pertussis, and MMR and varicella. But most of responders reported a variable time between vaccination and transplant. So we are before the transplant now. So for inactivated vaccine, and for example, pneumococcal, meningococcal vaccine, or hepatitis B, we see that frequently they proceed before the 2 weeks recommended. So usually don't pass the 2 weeks and they proceed with the transplant. With if need urgency, they can do the transplant before the 2 weeks. And differently from live but attenuated vaccine, so MMR and varicella, the time between vaccination and transplant is usually 4 weeks or more in most cases, while around 1/3 of responders reported a shorter time between 2 and 4 weeks. So rather period. As you can see from these slides, in the post-transplant by sites are flu vaccine, and hepatitis B. And before proceeding with vaccination after transplant, the 26.2% of responders check immunoglobulin levels or complete blood cell count with differential. The 9.5% check IgG subset determination, and while the majority, so the 1/3 of responders, do not check anything before administering vaccination after transplant. So at the question 11, so which antibody titers do you check after transplant? We see that after transplant, the most checked antibody titers were varicella, hepatitis A, and hepatitis B, usually in a time period between 7 to 10 months after transplant. And when MMR antibody titers were checked, it selection that can happen between the 4th to the 8th months after transplant, 9 to 12 months after transplant, and 13 to 15 months after transplant. So it's quite variable. Almost all sites recommend immunization with a vaccine in the post-transplant period. So all these vaccines, all the inactivated vaccines are recommended, and differently from MMR and varicella, usually are not recommended except in rare cases. Usually the window of time most preferred by investigated sites is between 4 and 8 months after transplant, followed by 13 to 15 months, especially for varicella and MMR. I would like to underline that in few cases, activated are administered between 0 to 3 months after transplant. So it can happen, but rarely. So investigating other aspects related to solid organ transplant and vaccination, we found that around 70% of sites use the same schedule for pneumococcal vaccination. and around administer the RSV prophylaxis, and who provided around 20% of responders recommended only for patients younger than 2 years. So talking about influenza, the flu vaccine coverage is widely variable among the sites. So with almost half sites with 40 to 60% coverage, so good coverage. And only one center reported a flu vaccine coverage between 80 to 100%, so very high coverage. And at the question virus vaccination for family members, we see that almost all centers, so 96.4% of responders recommend the influenza vaccine also for other family members, but the 40.3% of these responders only for limited time. So analyzing now the responses that we received from the Hematopoietic Stem Cell Transplantation, we found that here responses are lower than the solid organ transplant sites, so only 6 sites, so 6 sites from 6 different countries response to the survey. So the number are quite low. But what we can see here, so that we can see that the 4 responders had more than 15 years of experience, and the other 2 are experienced between the 10 and to 15 years. Hematopoietic Stem Transplantation, so just 2 of 6. The reason of possible under-immunization in the patient, and what we see that both are agree that the patient general conditions, so the patient too sick to receive vaccine, are the main cause of under-vaccination in the patients. Checking what happened after the transplant from before giving other vaccination, we see that before proceeding with vaccination after transplant, the 31% of responders check immunoglobulins levels, the other 31% complete blood cell count with differential, and the 25% check the lymphocyte subset analysis. For the 6.3% do not check anything. No information was available about the checking antibody titers before the transplant, and also if this center so which antibody titers they usually check up. We see that antibody titers after transplant was not a common practice, and 2 sites reported hepatitis B titer is always checked, while MMR, varicella, and tetanus titer are checked rarely. And when antibodies are checked, timing is highly variable, so it's impossible to define a trend in this case, because the data are quite scattered, and so there are only 6 centers that participate to this survey. What we know is that almost all sites recommend immunization with inactivated vaccine, as well as MMR and varicella in the post-transplant period. We just have to say that for live attenuated vaccine are not recommended in half of the sites, so it's more recommended compared to solid organ transplant, but we see not all the sites are also in this case months or until the child is on single agent immunosuppression. And according to literature, the period is longer with the booster dose between 16 to 24 months after transplant. What I would like to highlight is in a few cases, inactivated vaccine are administered between 0 and 3 months, also in this case. So investigated other aspects related to vaccination also for hematopoietic stem cell transplantation. We see that around 50% of sites use the same schedule for pneumococcal vaccine. And 100% of all sites do not administer the RSV prophylaxis. And the influenza vaccine coverage is widely variable among sites, with almost 1/3 of sites with a coverage between 60 to 80%. In another 1/3, the coverage is 40 to 60. In even at the answer, if the seasonal influenza virus vaccination, as recommended also to other family members, we see that 66.7% of sites, so 4 sites, recommend the influenza vaccine also for other family members, but and the other 2 only for a limited period of time. So thank you very much. Are you that you can hear me well now?
Yes, now can hear you properly well. Maybe any of you want to make any comment or question about the result?
Well, yes, congratulations for this fine presentation, Daniel. I think there are a lot of data here in these your slides. Our plan is sending to all of you the results of this survey so that you can analyze the results quietly and at home. And in the next weeks, we send these results to all of you. The plan, as always, with this, sorry? Well, the plan, as always, with these clinical audit results is to try to publish these results, and well, we'll try to do it in the next weeks, months, and we'll try to publish because we consider that it's very interesting results and to be published. So, any question, any comment, any suggestion?
Sorry, it sounds like I'd like to comment that is a fantastic piece of work. And is there a big echo? Is it possible to hear? So I'll keep trying. It's a fantastic piece of work, and I would have thought it would make a very good publication and a very useful publication. To say the consensus, and it is a consensus, is that certain vaccinations at certain times are typically what people use, and the other ones are a matter of judgment, and these are circumstances where the judgment has been used. I think it's hugely valuable.
Thank you, Dr. Baker. Okay, we agree on that. Any other comment? No. Again, congratulations and thank you, Dr. Donà, and we'll send these results to all of you. Thank you.
Thank you.